So within the preferable effect study, we mainly looked into the effects of exercise in patients with metastatic breast cancer on fatigue and quality of life. So we randomized 357 participants into the exercise group or control group. And the control group received care as usual, supplemented with a general physical activity advice. And the exercise group received a 9-month exercise program under supervision of an exercise professional. So they trained twice per week at this physiotherapist. And we just looked into the effects of fatigue and quality of life, which were measured at the beginning of the study, 3 months, 6 months, and 9 months follow-up. And we saw how that progressed over time. And we found that the exercise program led to improvements in quality of life and fatigue for our study population. So the study design, it was a randomized controlled trial, meaning that we randomly allocated patients to either the exercise intervention or to a control group. And we did this to make sure that we only find the effects of exercise and not, for example, treatment changes or that kind of factors that could influence our results on fatigue and quality of life. And so like I already explained a little bit before, is that we found positive effects of the exercise intervention on quality of life and physical fatigue. But of course, we also had a lot of other clinically relevant endpoints measured within our study. So we set out a couple of questionnaires, and also we found positive effects of the exercise intervention on pain. So people in the exercise intervention had lower levels of pain throughout the study. And we also saw that they had lower levels of dyspnea and were better doing in terms of physical functioning, role functioning, and also social functioning, meaning that they could better engage in social activities with their family and friends, or could have less limitations in their daily functioning. So they could do some gardening and that kind of activities that are really important to our patient population. So we found many different effects, and we also looked whether our effects apply to all patients within our study. So we looked into subgroups of our population, and we defined a couple of them. Like we looked into groups of age, tumor receptor status, but also baseline levels of pain. And what we saw is that patients who are have high levels of pain at baseline have higher or greater effects of the exercise intervention on quality of life. And we also saw that patients who are younger have, so an age below 50, have larger effects of the exercise intervention. But also in the older population, so people who are aged over 50, we saw beneficial effects of the exercise program as compared to the control group. However, the exercise program might need more tailoring for them, for the patients who are older than 50 years old, to benefit as much as the younger population. So this is just in a summary, our main findings of the preferable effect study. By many pathways. So what we saw, we had a quality of life questionnaire sent out to our participants, and by that we measured a lot of different aspects that might affect quality of life. And we saw that our exercise intervention led to improvements in several symptoms. So, for example, fatigue, pain, but also lower or better physical functioning and social and role functioning. And that altogether, I think, would have led to improved quality of life of the patients with metastatic breast cancer. And we know that having or maintaining a good quality of life also during your treatment with metastatic breast cancer is really important to those patients. And I think it's great that exercise can be of help for them and actually improve their quality of life over time. Yeah, well, I think it's also important for patients if they would like to exercise and did not hear about these results so far. I think it's always good to first start talking to your physician or your healthcare practitioner to start a conversation about exercise and see what might help you and what to take into account when exercising. And by that, they might refer you to a specialized trainer who can help you train during your treatment for metastatic breast cancer. So I think it would be good to get the conversation started.